opposition firmly believe that the government should not provide public health care, I would first like to start by refuting some of my opponent's points. They stated that the rich and upper middle class would only have to pay an additional $100 per year. But according to the New York Times Economy Report, the average upper class citizen would have to pay an additional $26,000 on top of all the other taxes that they are already paying. Now this money is going towards another man's health care. That is socialism. That is fundamentally against the way that our country was established economically. Socialism is not what made our country great. Capitalism is. Healthcare is not a right. Healthcare is an earned privilege that you obtain through hard work. They stated that all we need is a little bit more money. In case anyone hasn't noticed, money is not something our country has at this moment. We cannot spare a little bit more money for anything. If anything is true, we need to spend less money. They stated that we will have to spend more money. But they also stated that the people do not have money. So where is the money going to come from? The government doesn't just make money. The government takes money through taxes from other people. So if our people don't have money, but we need to spend more money, and the government gets the money from the people, where are we getting the money to fund this healthcare plan? They have made references to Canada and Great Britain. Both systems are failures because of socialism. The average Canadian patient has to wait 13.3 weeks in order to have an operation done in Canada. Their emergency rooms are overfilled. The NHS, which is the system that Britain uses, and it is universal health care, has been established since 1948. In its first year, it was $14 million over budget, which in 1948 was a large amount of money. And Great Britain is in a deeper deficit than America is currently. This is due to their socialist systems. Canada does not provide good enough equipment for their patients. America, on average, has 3 times better technology that we provide for our patients than Canada is. My source for this is the NAO and Dr. Lawrence Reed of the NAO. There was a Canadian Premier Barossa who actually went to Chicago to receive care for the cancer that he had, instead of using the free health care that would already have been provided for him within his country. Doctors would also lose their right to choose patients and would be working 12-hour shifts per day for $50,000 per year. What we are doing is we are stretching less money over more people. Doctors will be overworked and they will lose their will to go through 8 expensive years of medical school to serve 12-hour shifts every day for $50,000 a year. Also, people, as my friend Aaron stated, people will abuse the system because they know that they're being given free, unconsequential health care. In Great Britain, the average citizen has to pay 24,000 additional pounds per year in order to provide for the NHS. 24,000 pounds is more than the $26,000 the Americans would have to pay, showing that the system obviously doesn't work in other countries. They stated that America is not Canada, and therefore we cannot be compared to them. But they also stated that we were 43rd globally. So they are still comparing us to other countries. So can we or can we not compare ourselves to other systems used? Also, America is one of the most populated countries in the world, and therefore we cannot be compared to countries that have better health care than us because they have lower populations and they do not put the value on quality that we do for our health insurance. Quality, not quantity. That is what this country was based upon. That a man has to work for what is given to him. And if somebody doesn't have to work for the privileges they have, then they will not only abuse the system, but the quality overall of the health care will be decreased nationally. I would also like to provide some sources in case it comes into question later. Thomas Powell, the clinical senior lecturer at the Michigan Health Organization, Professor Cookson of the same organization, and Pamela Northcott. I would also like to say that in various parts of Great Britain, some people can't receive basic medications such as cortisone and psychosomatic drugs like Avastin, Nexafar, and Toracel. These are basic, cheap drugs that cannot be provided to the people who need them desperately because the government has become stretched so thin over universal health care that they cannot afford to provide basic medical insurance and provisions. In Great Britain, a woman of 65 years old lost her NHS coverage because she sought alternative methods of relieving her cancer issues. The NHS purposefully and specifically took away her coverage because this system does not allow the people, the employers, the private industry, or the healthcare industry to seek methods that are not held to the standards of the NHS or of universal health care. My name is Jake Kirian. I, along with the opposition, firmly believe that the government should not provide public health care, and because of all of the reasons I've stated, we have clearly won this debate.